With that note, ladies and gentlemen, now it's the time we move on to our next partner spotlight. Certinal. Certinal is a trust, consent, and compliance platform helping hospitals and health system digitize patient consent, identity number verification, e-signature, and regulatory compliance through one integrated platform. Built for frameworks including HIPAA, India's DPDP Act, GDPR, PDPA, and NABH, Certinal helps make every patient interaction more secure, traceable, and trustworthy. To share more about driving enterprises growth and SaaS adoption across global markets, we have with us Mr. Sudhir Kaveti, Vice President Global Sales at Certinal, with 19 years of experience in software sales and business development. Sudhir has led enterprise SaaS adoption and digital transformation initiative across global markets. So please put your hands together and join me in welcoming Mr. Sudhir Kaveti. Welcome to you, sir, and over to you.
Hello. Great. I see some empty tables already, but this is one topic which I'm going to cover today, which is the most discussed topic in the boardrooms of most healthcare organizations, not just healthcare, multiple organizations in India. Over the last 6 months and the next coming 6 months, this will be the most discussed topic. So DPDP, which I'm sure most of you have heard and most of you are already aware of, data privacy is being most stringently being considered by the government of India, and it's being implemented in May of 2027. Okay, before we go into the DPDP itself, I'll just quickly cover the Certinal's journey. Certinal has been in the market for last 6 years now, during post-COVID time. However, we are a 100% owned subsidiary of Zycus. Zycus has been there in the market for more than 3 decades now, and it has been a leader in the source-to-pay market since 1998, and we are 100% owned by them. And since in 2020, during the COVID time, they have seen an opportunity that they have been seeing electronic signature is one such space where there've been a monopoly by large organizations, and we have seen that as an opportunity. So essentially, we started out with e-signature as a solution, and we have also ventured into healthcare e-signature solution provider, including the patient consent as a solution. And since then, we have made a tremendous progress in this space since the last 5 years. We have been one of the leaders in IDC. We are one of the fastest vendor to go into the Gartner Peer Insights, Gartner Electronic Signature Market Guide. And since then, we have filed 11 patents in our solution. And after that, we have specifically ventured, while DPDP was getting formulated in 2023, we have been already talking to multiple healthcare organizations globally, including Bumrungrad International Hospital, which is one of the Southeast Asia's topmost hospital in Thailand. And they're our customers since last 4.5 years now. So they use a solution for patient consent solution, primarily for admission consents, clinical consent. So while DPDP was getting drafted, we have been already providing a solution around that to the customers globally. However, since DPDP came, we also started, it was logical for us to get into the DPDP space as well. So we started, apart from doing clinical consents, we also started data processing consents in 2024 and onwards. And one of our largest clients in India is Apollo Hospitals, which is using our solution for their patient consent. And like I was mentioning, we are one of the fastest growing vendor in the electronic signature and consent space. We have been named leader in IDC and fastest vendor to get into the Gartner. And one of the biggest claims in this space, typically the NPS has been around 40 to 50. By any of our competitors in this space, we claim of 81 NPS, which is by far the biggest standard which we are maintaining. So we have 100% retention of customers staying with us since last 6 years. And whether it is healthcare hospitals, whether it is medical device companies, clinical research organizations, hospitals internationally, India, we have customers across with various manufacturing companies using our solution, who have been very large logos using it. Okay, before we go into the product itself, I'll explain you quickly on where all our product applies, primarily from a patient's journey standpoint. If you see, there are three major touch points where patient consent is required. One is primarily, even before the patient becomes a registered patient in any healthcare or a hospital, primarily where they come to a website, you still need to identify who this person is, even if you do not have exactly the name of the person. Identifiable information is the cookie consent. Starting from there, where exactly do you also capture that from a patient journey on a website. And then when actually the patient comes and walks to your hospital, that's where today you're collecting name, email ID, phone number, mobile, whatever information from a PII standpoint or SPA standpoint. All of that today is being collected on a paper. Obviously, whatever web forms or paper form which you have, our software embeds with them. That's where you need also a registration and for a data processing based consents. And the third major one is when they become your inpatient. I mean, when they get an admission into your hospital, that's when you need clinical level consents, which doesn't fall under the purview of DPDP still, but still this is the time where most of the hospitals needs to rethink that if they are actually digitizing the data processing consents, they should also be digitizing the clinical consents at this time. Because by the time, if they are applying this, adopting to solutions which is more compliant to DPDP, this is the same time you can have both clinical and data processing consents together solved for the organizations. It'll be easier transition for hospitals because the law has been there for 2 decades now. The IT Act of 2000, which actually governs the e-signature, has been there for 2+ decades. And this is the time where both DPDP and clinical consents together become a solution for. So whether it is at the time of admission, at the time of any procedures, there must be at least 5 or 6 or 10, up to 10 consents which are required during the stay of the patient in the hospital. At all touch points, you can collect consent seamlessly with our solution. From a product standpoint, so that was the solution where all the touch points are. Again, if hospitals are still there in the midst of thinking where we are from a data standpoint to where should we start. So we provide 100% end-to-end DPDP solution for healthcare organization. We are made for healthcare organizations primarily. So starting from DPI consulting, where we can do a gap assessment, we can do an impact assessment, and then further, first thing is identifying the data. Where all touch points, where all collection points you are actually collecting the PII data of the patients needs to be identified. You need to do a discovery of that. We provide tools to do that discovery. It could be an organized database, unorganized database. It could be endpoints like laptops, desktops, devices. We provide you tools around that, which can scan around all of these devices and databases to provide you a data discovery. Identifiable PII information so that you can identify where all it is residing today. And then once that is there, you do a privacy audit, and now your actual application comes into picture that, okay, now I know where my data lies. And from there on, how do I put mechanisms to whether it's a web form, kiosk, mobile app, wherever is the touch point where you're collecting the data, ensuring that those collection points have a consent management platform. So you collect consent using our platform. We become the centralized consent management platform for hospitals. So we primarily don't really collect the patient information. We only collect the consent information against a data principle. That is the patient information. And so that's our consent flow module. And then also provide rights for the patients. So that is the data principle here, that what exactly consents which I have provided. So along with the first notice, when the first notice goes to the patient, what are the consents which is given? You can view them, you can revoke them, and then again you can raise requests for what exactly, whether I want to erase it, I want to access that information, I want exact specific information for correction. All of that can be raised using our rights portal. And again, the consent map. So while consent management is one part of DPDP, compliance is another part. How do you do that is, again, you need to have a clear lineage between what data is being collected and where exactly it is being stored. And starting from information at the granular level of data which is being collected and which table and column it is going to. So that kind of data lineage can be built in our consent map module. And consent govern is ensuring that you're audit ready if you have any third party audits happening, internal audits happening, even a data protection board audit is happening in future. You can also do that. In consent principle, it is a self-service portal for the patients to ensure you have a rights management for them as well. When they use that, those requests flow down to your DPO in the organization to review those requests. So these are broad modules which we provide as a solution. While that's the solution, these are the 7 questions which most of the hospitals are thinking or should be thinking or should be worried about as the DPDP is being implemented. A few of them, these things will be also addressed by my colleague Kanjan, who is the head of our products, who will be his next panel session. In fact, these are the major ones, like for emergency patients, how do we deal with it? Because consent, is the consent record? Where is it recorded? That's the first question which hospitals should think. Does the consent treat, or, for example, if you collect consent, you must be collecting data, but does that mean can I share it? So implicit consents, you should also look at that. The third one is minor. How do you deal with minor consents? How does that, after they turn 18, does that guardian consent is still valid? Those kind of things. How do you prove the authorization of consent? How do you have erasure requests versus retention rules? For example, you collected a consent and then you retain it for a particular period of time. And then does that erasure request means that you completely erase the data unrevocable? Or do you want to keep that data versus just the consent to be erased? So there's a different fine thin line between that. You should also be thinking about that. And also discharge summaries goes out in WhatsApp, email, or even a link which is openable. I mean, anybody can open and view that. It has all the personal information. You should be also thinking about that. Who's accountable for that? It just goes out and the patient is out of the hospital. But someday if anybody is filing a complaint, what exactly we should be doing? And again, current sectorial laws, like NABH is there is ABHA there is so many sectorial laws, Evidence Act is there, IT Act is there. How does DPDP compare against these sectorial laws? And what supersedes, does DPDP supersede it? Does the sectorial law supersede? These are 7 questions which ideally all of you, if you're from healthcare organization, should be looking at it. Should ask yourself ideally. So today we are almost at the end of July. There are just 10 months left for the DPDP to go live, and government is serious about it. It's no more extensions. Already the law has been there the law has been drafted, then went live December 2023, and then there's been guidelines which have come in November 2025, and there is a DPO, Data Protection Board, which will be assigned in November of this year. And May 2027, what should you be doing? In exactly 10 months from now, and I know that this is the most discussed topic in the boardrooms of large hospitals, because hospitals are the significant data fiduciaries, because they deal with a lot of data principles data. So how should the organization deal with this? And of course, you all know, I'm not going to go into each of the details, but it spans from 50 crore to 250 crore. So, but again, the DPO, the Data Protection Board, decides how much exact fine, if any complaints are being raised. But chaos is going to happen after if hospitals don't take action now. So 10 months now, what are you guys doing? Happy to take any questions now or maybe later as well. Yeah.
From a timing standpoint, where you are addressing the problem, I remember the Y2K.
Yeah.
So one of the things that happened and went very well for certain companies was they produced something like a prospectus or like a docket, and they shared it with a large number of enterprise companies to say, Y2K is coming, these are the things that you need to do, failing which this is what is likely to happen to you. So maybe in your interest, you may want to do that and circulate it to both the B and C class hospitals. The A class will have their own environment to support them.
Yeah.
But the B and C, it would be very, very relevant if you would do that. It would serve your interest very well.
That's very well point made. In fact, for all tier 2, tier 3 city hospitals or hospitals not in the metros, we have been tying up with few organizations in India which deal with those organizations. We are trying to set up some sessions, webinars, to ensure that they understand the gravity of the situation and also what needs to be done. So obviously this whole problem is in two parts. One is understanding the problem, and the second is how to fix it. So I think what you mentioned, that understanding the problem is the major one which needs to be done, and we are trying to do our bit of it by reaching out to various tier 2 cities. Yeah.
Yes, sir.
Yeah, so time constraint. Let's talk after this. So, yeah, so no problem. There are a few questions, but let's talk after this. This is a real burning problem. Like sir mentioned, understanding is a big gap, and also implementation has to happen very fast. May 2027 is not too far away. I'm happy to talk. You've done good progress as compared to many others in this space.
Especially because we have been catering to a lot of healthcare hospitals even prior to DPDP. It was logical for us to do this, and we were doing clinical consents before, and now we extended to data processing consents.
Great, let's talk.
All right, thank you, sir. Thank you so much. And I request Mr. KP Nadik to kindly join us on stage to hand over the gift of honor to our partner spotlight. Well, ladies and gentlemen, once again, let's give a huge round of applause for him. And thank you so much for all the insights that you have provided for all of us, sir. So, well, thank you. Thank you so much for both of you. Thank you so much.